Welcome back, everyone. When you save for retirement, are you thinking about how much you'll pay for health care? It's a cost that is on the rise. Mickey Powell of Powell Financial Partners is with us this morning with some good tips to help us with our money. Good morning to you.
Good morning, Erin.
So this is, honestly, this is a topic I've never thought about because I think most of us who have full-time jobs have health insurance, and so we don't think about what's going to happen when I don't have that job anymore and still need health care.
You know, people are very, very concerned about health care and the rising cost. If you've had anybody that's been sick or in the hospital lately, you know how serious of an issue this is. And then especially when people are retired, you know, they think, oh my goodness, you know, am I going to have enough money? Am I going to be able to make it?
What are your options? I mean, once you hit retirement, are there tons of things out there, a lot of things to shop for, and people, you know, throwing different offers in your face?
You know, the big key there is, are you 65 yet? Because at age 65, Medicare kicks in. And you can sign up for Medicare 3 months before your 65th birthday, the month of your 65th birthday, or up to 3 months after. And at that point in time, you have those benefits. But, you know, people need to understand that that doesn't cover everything.
Okay.
You know, the typical Medicare bill, you know, that you get from your medical provider, Medicare pays a little over half of that. You know, so there's a tremendous need for a supplement of some kind to make up the difference. And you know, most people can plan on a couple, if they live a normal life after retirement, of spending, believe this, $266,000 in uncovered medical expenses.
Wow.
You know, so there's this tremendous need that's out there, and people need to plan and prepare for it.
Yeah, I was going to say, when you say supplement at retirement, I'm thinking, okay, that's where the red flag needs to go up in my mind. At, you know, in my mid-30s, I got to start saving for that now.
It's never too early to start saving, you know, period, you know, for lots of things in your life. But, you know, when you start talking about Medicare, as we said there, Medicare is going to cover probably a little over 50% of your medical expenses. So people look at Medicare supplement plans in policies, and these can be supplemental plans. It can be Medicap, it can be Medicare Advantage. And these things are intended to pick up what Medicare does not pay. And kind of like other kinds of insurance, you can have a plan where you pay a lower premium. Well, you get a lower benefit, but there is a benefit there. You can pay more than you can get a real Cadillac plan, if you want to call it that, you know, that covers all kinds of stuff for you.
Yeah. Let's talk now about long-term care. I know a lot of parents, this is a reality for them because they're trying to figure out what to do, you know, with their parents as they're getting older, and it has got to be expensive. I've been in some of these long-term care facilities, and some of them are pretty swanky. They
really are. An assisted living plan, you can easily pay $3,500 a month. Okay, and this is just a, you know, pretty much an independent living type place where you get some help. But think of it like this: if your health declines and then you need full-blown nursing care, that can be over $200 a day. And we do the math on that, that's over $6,000 a month. So here you've been saving all your life and you've done well, but then you start having $6,000 a month or more going out, you know, to take care of your needs. You can start depleting very, very quickly what you've saved.
Where does that, I've always wondered, when someone cannot afford to stay in one of those facilities themselves, is it the children and others who do have to pitch in a lot of times if there haven't been steps that have been taken to prepare for that down the road? You've
hit the nail on the head, and I see that all the time. You know, where an older person, you know, they've done their best, they've saved their money, and we always need to be encouraging, we always need to be uplifting and support families. But yes, family members, children are going to have to step in and start providing to provide the care. Yeah,
for sure. Okay, so finally, I mean, what can we do to set ourselves up for success? We know these expenses are coming. We know we need to plan down the road. So what is that next step?
Well, I think a month or so ago, none of us won the lottery.
Nope.
So we need to save. Check into these Medicare supplement plans, okay, that kick in after age 65. And then I'll tell you, one of the greatest things of all that we can all do, and we can start now, and that's try to be in good shape physically. Eat right, exercise, get the right amount of rest. Try to be very, very healthy so that your medical expenses are less when you get to retirement time.
I like those tips because we had a nutrition segment about 15 to 20 minutes ago. So
Did you really?
These two go hand in hand.
Great, great.
Cut back the sugar, up the fruit intake. So
there you go.
Who knew that could also mix into financial planning?
It all works out.
Thank you, Mickey, so much for
Thank
these
you.
tips.
It's good to be here.
Good to have you, and we're going to have all of this on our website at kxan.com if you missed any of it a little bit later this morning.